Thank you for joining Cancer Support Community Atlanta for this program. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. We invite you to sign up for our newsletter to stay connected to all future programs. Again, I'm Katie Armsby with Cancer Support Community Atlanta. If this is your first time joining a Cancer Support Community Atlanta program, we welcome you. We invite you to visit our website, cscatlanta.org, where you can see a complete list of all the programs that are offered in person and virtually for free. We have a lot of great nutrition seminars. We have a monthly nutrition seminar led by an oncology dietitian with Northside Hospital. And we also have some great rotating topics on nutrition. We have support groups led by licensed mental health professionals, stress reduction classes like yoga and Tai Chi. And we also have education programs like these. So if you're interested and would like to see a full calendar of events, please visit cscatlanta.org. And also there you'll be able to see our video library tab. So if you ever miss a live event, you can see, I think there's over 200 recordings in there of past programs. So we do invite you to check that out. And I'm excited to welcome today's program moderator, Kelly Shields. Kelly Shields is the System Endoscopy Program Manager for Northside Hospital. She has had her career in endoscopy for 17 years, including procedural endoscopy and inflammatory bowel disease and hepatology research. At Northside, Kelly has had multiple roles within endoscopy. Her current role involves many aspects of patient and provider support in the hospital, including department operations, process improvement, and community outreach. So Kelly, I'm happy to pass it off to you to get us started today.
Thanks so much, Katie. Just a reminder to everyone, as Katie's mentioned, that we do have the chat box for questions. We'll be taking some time at the end for a Q&A session. I do remind everyone that the Q&A session is for general questions about liver disease and liver cancers. Any questions related to specific kind of patient details and diagnoses and treatment plans won't be addressed during that time. We would certainly ask you to reach out to your doctor individually about those questions, or if you need assistance with finding a doctor, all of those things won't be addressed during that Q&A. At this time, I would like to introduce Dr. Hon. Dr. Sooki Hon is a board-certified gastroenterologist and transplant hepatologist with Atlanta Gastroenterology Associates. It's a partner practice of United Digestive. She specializes in viral hepatitis, autoimmune liver diseases, and liver cancer. Today, Dr. Hon is honored to partner with Northside Hospital and Cancer Support Community Atlanta to bring critical information and resources to those impacted by liver cancer. She looks forward to sharing her expertise and supporting this important conversation. So I will hand it over to Dr. Hon now, who will start the presentation.
Okay, perfect. Well, thank you so much, Katie, for the kind invitation from Cancer Support Community. And thank you, Northside Hospital, for inviting me as well. Do appreciate Kelly being involved. She has been absolutely a wonderful resource for us in GI and for Northside and as a whole. So I do appreciate her time in participating in this event. And thank you all for being here. And you may wonder why this month? Why are we doing this liver cancer talk in the month of October? And you may not or may not be able to see the color of my shirt, but it is green. It is green for liver. So this is October, which is Liver Disease Awareness Month, which you may or may not know. So that's why Cancer Support Community and Northside has decided to kind of focus this talk this month on liver cancer. And so welcome everybody, and happy to kind of share this information to kind of generate more questions, give more understanding, and certainly help you guys in your journeys, either as providers or patients. So moving forward, again, thank you to our network partner, which is Cancer Support Community of Atlanta. Katie already went through some of this information, but do visit their website, cscatlanta.org, for additional information about all the wonderful resources that they are able to offer us. The Cancer Support Community does help us at this kind of uplift and strengthen all of us who are impacted by cancer, giving support, fostering communities, and also breaking down some barriers to care. Okay. And here we are. So I am a board certified gastroenterologist and hepatologist. So I work at a practice called United Digestive or Atlanta Gastro. You may recognize our logo here or some of the logos of some other partner practices that are part of the United Digestive. Certainly we are one out of many different practices out there providing GI and hepatology care. So, but happy to kind of help you guys on your journey as well. But today, before we move forward, I do have a disclosure to provide essentially that I am on the speaker bureau of 3 companies called Madrigal, Intercept, and Ipsen. However, these relationships are not related to the topic of liver cancer, and this presentation is not sponsored or by any of these 3 companies. And these following slides were reviewed by myself today, right? So we'll start off with some kind of general, just to get everyone on the same page about what is liver cancer itself, okay? And you may be wondering, what is the liver? So, well, the liver is one of the largest organs in the body. It is certainly, in my opinion, one of the most important organs in the body. It sits in the right side below the lung, and just like all important squishy organs, protected by our rib cage. Sometimes when you're doing exams, we kind of feel down here, or if we feel the liver down here in the belly, that means that the liver is a little bit enlarged. Now, the liver is very important. It does many functions. 3 of them are highlighted on this slide. Functions to filter waste and toxins from the blood, functions to make bile, which is an important digestive enzyme, and also storing and producing some important nutrients as well. So liver as an organ is certainly kind of one of the most important organs that we cannot live without. But unlike a lot of the other organs that we have, it is an organ that is susceptible to cancer. So liver cancer does form from the tissues that are within the liver. And it can be a liver cancer that originates in one of the tissues of the liver, or it can be a secondary, meaning that it came from somewhere else in the body and then spread to the liver afterwards, what they call liver metastases. The purpose of this talk today, however, will focus on what we call primary liver cancer or hepatocellular carcinoma. HCC would be the abbreviation for that, hepatoma being another synonym, but we're going to talk about essentially primary liver cancer. So there are certain risk factors that we worry about for patients to make them a little bit higher risk for having to develop primary liver cancer, hepatocellular carcinoma, or HCC. And you can see 5 of those major reasons up here. Having cirrhosis or a lot of scarring in the liver certainly would be a big risk factor that would increase your risk for having liver cancer. But other risk factors include family history of liver cancer, having infections that are active with either viral hepatitis B or C. In addition, a disorder that's really increasing in prevalence in in the world really, is what they call MASH, metabolic associated steatohepatitis, or what is commonly known as fatty liver. So having fatty liver in and of itself does increase people's risk for liver cancer. And in addition, excessive alcohol consumption would also be considered a risk factor for development of liver cancer. So if you do have one or more of these risk factors for liver cancer, then you and your provider may need to follow a regular surveillance interval of a schedule of lab work as well as imaging in order for us to detect liver cancer early and not too late. And you'll find out the importance of it in the next couple slides. We'll go over first and talk about some of the symptoms and how we diagnose liver cancer. So liver cancer symptoms can be varied. Many liver cancer symptoms can arise just like any other diseases or other cancers. It can be something like abdominal pain, weight loss that's unexplained or unintentional, a loss of appetite, or more specific for kind of the GI tract or the liver, jaundice or yellowing of the eyes or the skin, However, many patients find that liver cancer can develop without any outward symptoms. So if you do have any of those risk factors for liver cancer that we mentioned earlier, certainly, speak to your provider and talk about whether you might need a regular surveillance to look for liver cancer and find it early and detect it early so that treatment options can be started. So to diagnose liver cancer, the ways are varied, but first we would start with a physical exam. They can include blood tests that include the liver function, as well as what we listed here are tumor markers. So alpha-fetoprotein, or AFP, and CA19-9 are two what we call tumor markers. So those are blood tests that can be elevated with liver cancer. They can sometimes be elevated for other reasons, and some liver cancers do not have these tumor markers to be elevated. But certainly they're a helpful adjunctive tool for us to use when we're trying to evaluate the patient and diagnose them with liver cancer. Imaging, however, is going to be the primary modality that we pick up liver cancers. So with the imaging, they can include things like ultrasound, a CT scan, or an MRI scan. And these tests are very good to detect the cancers and also help characterize potentially the spread of the cancer if it's already at that stage. Finally, some liver cancers may not be fully diagnosed based on blood work and imaging, and they may be required some what they call tissue diagnosis. And so procedures may be required, like a biopsy or laparoscopy, in order to actually have some of the tissue of the lesion to confirm or exclude that diagnosis of liver cancer. And so based on these tests, then a diagnosis of liver cancer can be made. So the next step generally after we've made that diagnosis of liver cancer is what they call staging, okay? So liver cancer staging, like other cancer staging, is important because it determines the extent of cancer in the body, how far it has spread. Staging is based on the size of the tumor, whether or not the surrounding, what they call lymph nodes, contain cancer, and whether the cancer has moved or spread from the original site, in this case the liver, to other parts of the body. And so it would answer the question on the staging of how widespread the cancer is, which treatment options may help, as well as what we know about the tumor itself. And liver cancer staging is based on a criteria. Most of us use this Barcelona Liver Clinic liver cancer staging system, or BCLC staging system. And again, it answers or utilizes the information of, has the cancer spread from the liver to other places? And one of the earliest places that it may spread, in addition to the surrounding areas around the liver, that liver cancer can often spread to the lung. It also takes into account how well the liver itself is working, as well as the general physical condition of the patient. And so it utilizes all this criteria, and then we can understand, is this cancer in a very early stage or stage 0, in an early stage A, intermediate B, advanced stage C, or at the very end at that terminal stage of D. And once we do this staging, so after the liver cancer is diagnosed, when we find out about the staging, then we can understand what the treatment options are depending on the stage of the disease. In the early stage, or the very early stages, or in the intermediate stage, the options do include, and this is not an exhaustive list, but they do include commonly either liver resection, where that cancer may be removed surgically, or treatments that a radiologist may be helpful for, including things like ablation or chemoembolization, or even liver transplant if the liver has not advanced past that early or intermediate stage of disease. If the liver cancer progresses and it's in more the intermediate or advanced stage, and then we kind of include in more of the systemic treatment that people commonly known as chemotherapy, but those would include things like immunotherapy or the molecular targets. Essentially, that's where the oncologists are helpful with. And sometimes it is a combination of treatments that are utilized, depending on the tumor itself, depending on the staging of the tumor. So that's why these ovals here on this slide are having that interlap, because they're sometimes we do pull from one modality or the other, depending on the type of cancer that and where it is. And finally, unfortunately, at the terminal stage of the disease, if one is unfortunate enough to be diagnosed at that point or developed or advanced to that point, then essentially we'll consider that all our therapeutic options have been exhausted. And at that point, in that terminal stage of D, we would consider utilizing supportive care, and which would include both palliative care and hospice care services. So to go into treatment options in a little bit more detail, but first, as we all go through this journey after the diagnosis, after the staging, then we have to perform what's called treatment planning, or really planning and deciding on the steps that we take to treat the cancer. So that includes, from a provider standpoint, what you see on the bottom of that slide, which is the information that we'll provide as far as where the cancer is, where it is in other parts of the body or the staging, and also what the treatment options are and the side effects of treatment. And where the patient comes into this decision-making process is essentially your symptoms, your personal preferences, so how you feel that you should be treated, as far as how aggressive you want to proceed, perhaps, and really your goals of treatment. And so for this really should be a collaborative effort with the entire care team, which includes providers, which includes social workers, pharmacists, dietitians, as well as patients and patients' families, to really come in to the same table and really provide all these 5 bits of information, and then come up and formulate a treatment plan moving forward. But just to go over a little bit more detail of the options that are available once liver cancer is diagnosed. First, let's go and talk about surgery. So surgeries to remove the liver tumor would include kind of a smaller resection, and that would include things like a partial hepatectomy, a segmental resection, or a wedge resection, where a smaller portion of the liver is removed. Or if the liver cancer is a little bit more involved or larger, what they would consider a major liver resection, where half or even sometimes more than half of the liver may be removed. And that would be the terms of right or left hepatectomy, or even a lobectomy. And finally, depending on the staging of the liver and the patient, the surgery may be an option to do a liver transplantation, and that would be essentially a removal of the liver with the liver cancer, and then subsequently replacement of the liver with a new donor liver. So that's a slide on surgeries. In addition, other options to treat liver cancer would include what is considered a local regional treatment. So this is where the treatment the cancer is treated in the kind of essentially in the liver itself, and this is kind of the purview of the radiologists or radiation oncologists that we partner with. And essentially what this means is that instead of removing the tumor in the surgery, that we would treat the tumor in the liver itself, and that could take a variety of modalities. That could be either heating the cancer cells, or what's called radiofrequency ablation, freezing cancer cells, or cryoablation, or treating the liver cancer directly at the site with radioembolization or chemoembolization. With radioembolization, you may have heard the terms Y90. That's what that means. In addition, radiation oncologist can sometimes be called on to treat the cancer with this external beam radiation therapy, where essentially radiation is provided from outside the body. And that's a little bit different than the radioembolization that the radiologists do, where essentially they would access the tumor through veins, and that would go down into the liver itself. But these are different examples of what they call local regional treatments of liver cancer. So treating the liver cancer within the liver itself, that doesn't require any big incisions or actual surgery. And finally, we can talk a little bit about systemic treatments. And I just put up some names that are on there, just names that you may see or encounter as you do your research. Essentially, systemic treatments fall under the purview of medical oncologists. Okay. And there are three broad categories of types of systemic treatments that are offered nowadays for the treatment of primary liver cancer, or HCC. Most patients now are offered immunotherapy. And essentially these would be monoclonal antibodies. You can tell that by the AB at the end of these names. And these would be agents that would be targeted at different molecules that would be aimed to treat liver cancer, and generally liver cancer that's a little bit more the advanced stages. Multiple different modalities that are out there, usually combination therapy or sometimes monotherapy. There are some patients who would do a little bit better with some molecular target agents, and a few of them are offered what they call cytotoxic chemotherapy, or chemotherapy, or that traditional chemotherapy that aims to kind of kill the cells as well. But these are all potential treatment options for the medical oncologist to treat liver cancer. And so the decisions and the pros and the cons of all these treatments really need to come with the guidance of the entire care team that you have available for you, okay? So your treatment team, after you get diagnosed with liver cancer, would include many, many people. So this is the time to start taking names, taking cards, writing them down, because it's going to be a multidisciplinary team. And that's really what we have found, that patients would be the most successful with their cancer treatment, is by having really a team of specialists that provide all their own specialized expertise to really help you in every area, because cancer treatment is not really kind of isolated to one part and one organ. It affects everything and everybody. So that's why this is your village that you need to amass among around you. So your multidisciplinary team may include not just your physicians, especially the ones that are specializing in GI disorders. And again, your physicians may be GI doctors, liver doctors, radiation oncologists, medical oncologists, radiologists. In addition, nurse navigators, your mid-level providers or practitioners. Pharmacists certainly play a very, very important role in helping us kind of navigate drug interactions, side effects, and so forth, and making sure that medicine lists are reconciled. Dietitians, thank you for joining. Because dietitians and nutrition, definitely plays a role. If without good nutrition, really it's hard for the body to heal. And so it's very, very important for a dietitian to be part of your care team, really to help optimize your nutritional status throughout the treatment course and afterwards as well. Palliative care, just a note on that, definitely with the diagnosis of liver cancer, I urge folks to call on to services of palliative care. So they essentially come in and help when there's a diagnosis of any chronic illness. This is not synonymous or the same as hospice care. Palliative care really helps when all these there's a big diagnosis like liver cancer, and they really help kind of fine tune a lot of the questions that you may have, fine tune who to reach out to, how to get certain services on board. So definitely is a very, very important service that all patients with liver cancer should take advantage of. Social workers, so important as well for them to be involved with you. They help navigate real life. Okay, they help navigate what happens with your job, what happens with your caregiver's job, what happens with insurance. So all that is definitely under the purview of social workers, and they play a very important role. Mental health professionals as well, because there really is an emotional and mental health toll after a diagnosis of liver cancer is made, as well as chaplains and other religious providers as well. They are all part and important member of your treatment team. And so what questions should you be asking your team as you find them? And these are some questions not meant to be exhaustive lists, but really meant to kind of generate kind of the questions that you would want to ask your provider after you have that diagnosis of liver cancer. Find out the exact name, find out where it started, and has it spread to certain other areas. And that would be important because that's the staging of the disease. And we've learned already so far with the previous slides that the stages is important because it helps define your treatment plan. Are there other tests, scans, or biopsies that should be done to help decide what treatment I should have? And what treatment do you recommend? And really importantly, why? Okay, so get that question answered. Why is this the treatment option that is offered and recommended? And what are the pros and cons, and what are the side effects of this treatment? And also, really important, what is the expected outcome? You know, so a lot of patients end up with cancer treatment, and I ask them, hey, what are we expecting from this? Are we expecting a cure? Are we expecting stabilization? Or are we expecting just to kind of minimize symptoms? And so, you know, figuring out what the expected outcome of a treatment is definitely very important question to discuss with your team. Furthermore, you know, if you're not getting kind of enough answers, or even if you want more information, it is absolutely within your right, and you should, and nobody should feel kind of put upon to have a second opinion. Always good to have more voices, more ideas on the table. So certainly offers for second opinions may be useful to ask for your liver cancer care team. In addition, you can also ask them, how many patients have you treated with liver cancer? Is this the first time, or is this the first time today? Do you work with other specialists? Who else would you consider consulting on my care? Are there even clinical trials that are offered? So say this is the current standard of care, but if this doesn't work, are there other options such as clinical trials that that you could provide me? How would you stay up to date on latest treatments, and also other support services that, that the provider may have for other patients with liver cancers. So all these questions, again, not an exhaustive list, but really to start the communication process. Very, very important for all of patients with liver cancers to communicate with your team, because this can be absolutely overwhelming, and there's so many questions, and you probably are bombarded with questions from family. Bring that list so that you can really have an agenda. So when you sit down with your providers, that there's a list of questions. Bring somebody that you trust with you, because second set of ears is always good. And also just make sure that you get the answers that you need to these important questions. Definitely you are valued, your input is necessary. Other things to think about talking to your team, again, side effects of treatments, what specific mental, emotional, or physical concerns that you may have, any natural treatments or remedies that you may have available, have been used in the past, or people are asking you about, the medications that you are using or other medications you've heard about, as well as, most importantly, your personal goals and preferences of how you want to be treated and how you want others to approach you and your health. So a slide here about second opinions. Again, this can really help fine tune your decision-making process. So definitely don't hesitate to get it and make sure that your provider and any provider really respects your goals and wishes. Some other providers may just have a different outlook and a different way that they practice, which may be more in alignment with how you would want to be treated. So it's always good to just, to reach out and have other opinions. Especially if you're kind of here in Atlanta, we have definitely multiple providers, so it's always good. And tell people it's kind of like dating. You may not get the right one on the first date. You may need a second date in order to figure it out, or you may just say cut your losses and go to somebody else. So getting that second opinion may be an important thing for you in your treatment plan, because this is an important decision. Finally, a word on clinical trials. This is where, again, if your standard of treatment is not working, or really is not optimal for your disease and your disease process, certainly clinical trials are out there where you can access kind of new, potentially groundbreaking treatments. And just remember that every current cancer treatment was that's now standard, was first developed through a clinical trial. And certainly I've been in practice and old enough to have had many different iterations of this talk as new treatments become available, and I got to move that first line slide over to different parts of as new treatments become approved and put into as the standard of care. And certainly ask your doctor and talk about the clinical trials, the pros and cons, what's being offered, what's being covered, and see if that's going to be the right decision for you. Okay. So palliative care as well, I touched on this a little bit earlier. It is something that will support all patients with liver cancer, regardless of if you're in that early stage, very early stage, or at the kind of that terminal stage, stage D. Essentially, palliative care can support patients and patient families, discuss things like pain relief. It is not the same as end-of-life care or hospice, and really it is a complement. So it's an additional member of your care team that can really help navigate you through kind of the day-to-day kind of symptoms that you may have from as you go through treatment for liver cancer. So a section here about coping with the stigma and emotional impacts of liver cancer, because this is definitely a very difficult diagnosis to receive. So stigma is the feeling that you are negatively judged by others, which may be true or untrue depending on how you feel, and certainly it is not always the truth. And being a hepatologist or a liver cancer provider, I certainly see this a lot. There is an enormous stigma against liver disease in general. A lot of patients that I diagnose with liver disease will say, but I am not a drinker. I have never done any IV drugs. And I have to tell them liver disease can affect everybody. And so there is in popular culture a stigma that liver disease or liver cancer only happens to people who have done quote unquote bad things, who have been abusing drugs, abusing alcohol, or done kind of less savory things in life. But that is absolutely not the case. So it is important for me to really kind of break through that stereotype and let people know, hey, liver disease is something that can affect all of us. But certainly as you get this diagnosis, you may start having this stigma and feel that, people just are making these assumptions about you, and that can be certainly very detrimental to your emotional well-being. The truth is, as you all know, no one deserves cancer. And really no proof that your personal, even, if you did do any of these unsavory things, that really, there was that the cause or not. At this point, we all got to move on. it is not and really kind of break through and not kind of focus on the negative aspects that are incumbent with this stigma. And what you can do as strategies to deal if you do have experience the stigma against liver disease or liver cancer, really take the positive steps that you need that we outlined here. Get the care, be proactive, and be and really get your care team around you, people that will support you in this journey for treatment of liver cancer. Speak with folks who are professionals in this, like therapists, social workers, spiritual leaders, or even support groups. And certainly the folks here at Northside and also the cancer support community can help with that. And remember, really, it doesn't matter how you got it, what happened before, you deserve care. And really, let's take advantage of any new developments that are out there. Let's tackle this aggressively as much as we can to treat your liver cancer. And all of this is really with a goal to empower yourself in this cancer treatment journey. And we talked a little bit about stigma that you may experience just in being out there in the community, but sometimes you may even feel a sense of stigma from your care team. And this may be kind of an unconscious bias that people talk about, that that some providers may even unconsciously and being unaware of it kind of give you kind of a negative kind of feeling after you get diagnosed with liver disease or liver cancer. So certainly if you do start having those kind of experiences, advocate for yourself, share that with the provider, say, hey, that really kind of came across in a way that made me feel bad about this. That's a stigma. Remind folks, including providers, including physicians, you need the support and empathy. Your feelings are valid, and assumptions that others may be making are unfair. Really, liver cancer and any cancer, the emotional tolls can be huge. There can be a lot of distress, grief, stress, anxiety, as well as depression. Definitely kind of be aware of this if it does happen. And who do you go for support? Professionals like social workers, psychologists, mental health specialists, and support groups and networks, because they can help empower you and provide you with some coping skills to really feel more control and find comfort. But really ask for help at any point that you feel whether it be in the beginning of your treatment journey or at the end, okay? You don't have to wait for a certain level of severity. Don't wait until it really impacts you. As it happens, even at the time, just speak up and say, hey, I'm having a kind of a negative feeling. I'm having some distress. Let's address this and not just deal with the physical aspects of treatment. So because we all, after this diagnosis of liver cancer, need to think about really taking care and control of your future during treatment, after treatment as well. Because after treatment or during the course of treatment or after cancer treatment, you've got to find your new normal. You're going to be now, somebody with liver cancer. And even after liver treatment, liver cancer treatment, there may be some lasting side effects physically from the treatment. And so you may need to kind of figure out ways with your provider to help alleviate some of these side effects. There can be certain long-standing kind of effects on your mental health and emotional health. So definitely don't let any fears of what may happen in the future stop you from living in the moment. Have open and honest conversations with not just your providers, your family, but also with yourself as well. Okay. So as you get this diagnosis, set some goals, okay? And this will depend on the type of cancer that you have, any previous treatments, potential side effects, but really figure out with yourself and your family and provider, what do you want out of treatment and how would a treatment make you feel? As you go through this journey, there are certain things that I always want everybody to do. And no matter what, whether or not you have liver disease or liver cancer, all of us should have a living will or advanced directive. Really, that lets everybody know, not just your doctor, how you want things done. Okay, so this is definitely a very helpful piece document to have. And once you have it, really just give it and share copies with everybody and anybody, so that we can kind of essentially act on your behalf in the event that you cannot speak for yourself. Another way to do that is really a durable power of attorney. So essentially somebody that you trust that would be able to make health decisions for you, such as a healthcare proxy. Okay. And so, as we go into the future after the liver cancer treatment, your health may be different before or afterwards. You may be, hopefully, after the treatments in a state of what they call remission, where the cancer is gone. But there can be certain emotional and mental health tolls from kind of having gone through that journey. Some questions about survivorship and some worries even about the potential recurrence. So definitely speak to your family and your providers about kind of these issues, not just during treatment, but even afterwards as well. And then finally, a word on hospice care. Hospice care certainly is something that would enter in at that very terminal stage of liver cancer. And really, it is something where it's focused on symptom management and a quality of life when we're at a point where curative or other beneficial options for your cancer is been exhausted. So what this is not a cure that hastens death. This is really care that helps support you at this end of life. Okay. And it's really going to be a team that supports you and your loved ones and includes visits that would primarily take place at your home or sometimes in a hospice facility. And it is a Medicare benefit, so definitely if you or your patients are end up in that more terminal phase of the illness, definitely speak to your providers about hospice care and hospice services. And a word now about caregivers. Because cancer diagnosis doesn't just affect the patients, but it affects the family and the caregivers as well. And that can take an emotional toll. It can provide many emotions. It can be difficult to share your feelings as a caregiver with the patient, and with others. And so support groups are out there for caregivers. So do consider them and lean on other family and friends to help. Caregivers, when we look and when they looked at a survey of over 600 caregivers in the Cancer Experience Registry, the role of caregivers was so important because they provided not just emotional support and transportation, but really also helped with important things like decision making, finances, and just helping coordinate the medical care and being an advocate for the patient as well. So as a caregiver, make sure that you're taking care of you, prevent the burnout, set limits, pace yourself as you go through this journey, because this is an important journey for you as well, and make your needs a priority and be realistic about the amount of responsibility that you can provide in this, and definitely reach out and find support. Again, the cancer support community Atlanta has a friends and family support group that is out there and available that can help with not just patients but caregivers as well. Individual counseling and religious leaders and communities also another source of support for caregivers. And even if you're not local, caring for a distance can be helpful. Certainly it helps patients and other caregivers understand the situation, helps create kind of another set of ears, or even just another kind of sounding board about decisions, and really kind of listen really and seek help when you do need it. Okay. So multiple caregiving resources that are out there. Also learn about things like protected leave, financial assistance, and this is where social workers that are involved in your care team can help with their expertise in navigating some of these benefits that are available to you. Okay. So I think I've come to the end of my session here. I'll throw it over to Katie now to talk a little bit more about the services with the cancer support community. So Katie, if you can come back on.
Yeah, thank you, Dr. Hahn. That was a lot of great information. I want to briefly highlight a couple of resources available through our parent company, Cancer Support Community, which includes the helpline. You see that telephone number there that's available to connect with. There's also Cancer Experience Registry that is available. It's an online research study that helps to uncover the impact of cancer, and they do that by inviting others to take a survey where you'll share a little bit about your cancer experience. And then there's My Lifeline as well, which is also an additional resource. And you can create an individualized website to connect to others and kind of create your own community online. So I'm going to put some of those resources into the chat box so everybody can connect and learn more about them there. And I'll also attach a PDF of today's presentation so you can find out more information and reference them there. But right now I'll include Kelly back into the fold to get to the Q&A. So I will pass it off to you, Dr. Hahn and Kelly, to kind of spearhead the Q&A.
Great, thanks, Katie. Also wanted to mention in terms of resources, there's a ton of resources as well on the Northside Hospital website. It's northside.com. And there are a number of different links you can follow in the Cancer Institute section that cover the liver and pancreas program. There's actually a second opinion clinic option as well. We talked about second opinions. So another set of resources for any patients or caregivers that are dealing with liver cancer. So on to some of our questions for Dr. Hahn. The first question is, what are the benefits of treatment for those with stage 4 or more advanced stages of liver cancer?
So at that point, and thank you, Kelly, for that question, and certainly the additional information about the resources from Northside. So the question here is, what are the advantages of treatment when the treatment when the liver disease and liver cancer is very advanced? Essentially, the hope is at that point for stabilization. I would say, if you're unfortunate enough to be in that kind of more, advanced stage, it would be the goal at that point and expect and hope that treatment would stabilize the disease process and hopefully kind of prolong and your quality of life at that point. So generally the modalities at that point are going to be more your systemic treatments. So your medical oncologist would be there. And so you need to balance kind of the side effects of treatment with the potential benefit. So I would say at that point, not a cure, but a stabilization of your disease.
Perfect. And kind of along those same lines of stages and treatments, one other question was, is liver transplantation a treatment of choice for all stages, or is it limited to a specific stage, early stage versus later?
Yeah, so it is something that's only going to be available in the earlier stages of your disease. So that's why it came up in that early kind of bubble where, and that's because liver transplantation is something that you need a lot of medications afterwards to suppress your immune system to prevent rejection of that new organ. If there's already cancer that's spread throughout the body, once you start taking those anti-rejection medicines, then that cancer can actually flare up. Okay. And so then we would honestly be in the worst place than we had started. So it is a large and big surgery. We certainly in making that decision on whether or not to proceed down that liver transplant pathway, a lot is taken into account in particular kind of how healthy the patient is. Can you undergo a big kind of 6-hour surgery like a liver transplant? And also, is the cancer in an early enough stage where we would say the risk of recurrence after starting on these anti-rejection medicines is going to be low? Okay, so those are the considerations for a liver transplant in the setting of liver cancer.
That makes a lot of sense. Thank you for that explanation. Another question that came in is, how do you know, and I think we're going to talk more about some of the questions about how you can how you know what are the signs of different types of diseases, but how would you know, for example, if you have fatty liver disease or might be at an increased risk for liver cancer?
Yeah, so that's something that you would start with your primary care doctor. Okay. So, as you do your annual physicals, that may be something if you're worried about, say, let's talk to your provider in that annual visit. Again, bring your little agenda with your list of questions because it's so much, and providers sometimes have very limited time, and say, hey, I heard a talk, or, my family member was just diagnosed with liver disease. What are my risk factors? And they'll go over kind of your past medical history, your current kind of set of blood work, your medicines, and so forth, and kind of let you know what your particular risks are. And then if you do fall into one of those kind of higher risk categories for liver cancer, then they should kind of talk to you about potentially starting on that imaging regimen, so that liver cancer can be detected early. Okay.
And along with that, is there anything that family members or those at higher risk can do to lower their risk? Things to, diet, things like that, that they can do to help lower their risk?
Absolutely. So healthy livers love like essentially a generally good diet. Okay. And what that means is eat your vegetables, people. Everyone needs to eat more vegetables. Okay. I didn't say fruit, eat your vegetables. So really kind of a very vegetable based diet, what people call that plant-based diet, has been shown to be very helpful for the liver. There's not one particular superfood that's really particularly good for the liver, but really a very balanced diet full of fruits, some lean proteins as well, but they shouldn't take the majority of the plate. They should be kind of in that little corner, and very little what they call processed foods. Certainly some ingredients that we have found to be actually very harmful to the liver include things like high fructose corn syrup, which is that sweetener that's in a lot of things like sodas and other processed kind of pastries and candies and so forth. So really kind of a good generally balanced diet. If you want one to look up, a Mediterranean diet is probably one of the ones that most liver doctors do tend to promote, because it's really been shown to help with liver disease and help protect your liver.
Would you say that those diets are also helpful for patients who have already been diagnosed with liver cancers? Is there anything else that you would change or adjust?
Absolutely. But although first I would defer to our dietitians as well, because they know the best. But in general, yeah, I mean, and talk to your provider about those kind of specific questions regarding to your disease, but generally kind of that kind of Mediterranean style diet would be good. But once you get diagnosed with liver cancers and you're in the middle of treatment, your needs may change, honestly, and that may be because of side effects of treatment or whatnot. So kind of speak to them as far as, if you need things like nutritional supplements, protein supplements to help you along the way.
Perfect. Thanks so much. I had another question come in about family risk. And the question is, how do family members know if they're at an increased risk, if there is a family history, and is genetic testing an option?
I would kind of speak to your provider. Okay, so if you do have a family member who was diagnosed with liver disease, try to find, if you can, a little bit information about, well, what happened. What were that person's risk factors for liver disease, and then bring that to your provider and essentially say, hey, my family member who had, say, fatty liver, just developed liver cancer. Am I also at risk? Okay, and then they can kind of counsel you further about, what you can do further to protect your liver.
Perfect. Awesome. I think all of this kind of points back to that multidisciplinary approach and having all those different parts of your team, whether you've been diagnosed with liver cancer or have family members have liver disease, certainly highlights the need for all of those different pieces. So I appreciate you continuing to highlight those, because I think, we've learned in healthcare in general that more people helping is better, and there's a lot of different options for who can provide that support. So thank you for bringing that up. I don't see any other questions currently. And we're about to wrap up our time. So I think we've covered kind of all those topics. I appreciate all of that information, Dr. Hon. And then Katie, I don't know if there's anything you needed to add as far as resources.
We did get one last question popped up if you guys have a second. The question was, have there been any recent advances that have come from clinical trials?
Yeah, a lot of the recent advances really kind of fine-tune a lot of these treatment options that we have currently available. Really kind of even in my career, like I said earlier, options for liver cancers really have expanded. When I first started, really it was when the first kind of sorafenib was the first one that was kind of approved, and because it was actually the first one to show any treatment benefit in those advanced stages of liver cancer. So definitely, when you pick and find your providers, find one who's definitely up to date because the treatment options really change from year to year, month to month. And we're always getting new data about, which ones are better, fine tuning kind of the types of treatments that are available. So both in kind of the local regional therapies as well as in the systemic treatments, really advances are being made every year. So make sure that your provider stays up to date.
Yeah, thank you. Good advice. I think that's it for the questions in the chat box. I want to remind everybody, if you know someone who wasn't able to attend today's live program, we will have a recording available at Cancer Support Community Atlanta's website. Again, that's cscatlanta.org. I did put a link into the program chat box. If you could click that link, even if you're a healthcare professional, we ask that you take a short survey to kind of help us tailor the program information that is shared during our Frankly Speakings. And I think as we wrap up, I'm going to throw it out to you, Dr. Hahn and Kelly, to kind of share any final thoughts. I don't know if Dr. Hahn, you want to go first?
I just want to thank everybody for sharing your lunch hour with us. It's always kind of my personal pleasure to speak about liver disease, but a lot of those slides about the stigma of liver disease really, hit home. Many people are afraid to tell others that they have liver disease, and then down the line, then they're even afraid to seek help for liver disease and liver cancer. So really, I thank Northside. I thank you guys at Cancer Support Community for allowing me to have this opportunity to really provide more kind of education, more knowledge, and to really kind of break that stigma that people have against liver disease. To know that, yeah, this is something that can affect any and all of us, our friends, our neighbors, our family members. And so definitely utilize the resources that we have to so that we can really help eradicate liver disease, hopefully in the future. So thank you again.
Thank you so much, Dr. Hahn. And we appreciate your time as well to share this information. I know that it can really help a lot of people that are dealing with this or have family member or loved ones that are dealing with this. I also appreciate all of the resources that Cancer Support Community provides, that the Northside Hospital Cancer Institute provides, because it is so overwhelming when you're facing a diagnosis like this. And so having those resources available in that way, I think can help a lot of people. So appreciate the opportunity to be a part of this and everything that Cancer Support Community is doing.
Well, and we thank you both for being so generous with your time and expertise in today's program. We're getting a lot of thank yous and positive feedback in the chat box. So thank you everybody who is joining us. And again, thank you, Dr. Hahn. Thank you, Kelly. We hope to see everybody again soon. So everybody take care. Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.